Wisconsin, as you know, is in a COVID-19 crisis right now, with cases, hospitalizations, and deaths quickly adding up.
Here to talk about that and other coronavirus news is Dr. Zorba Pastor, joining us from his office in Oregon. And later he'll take your calls. Hi, Zorba.
Hi, Zorba.
Hi. Good to see you guys.
Dr. Anthony Fauci called the current outbreak stunning.
Right, and it is stunning. And what's interesting is that it's not as if this is really one outbreak. It seems to be almost 2 or 3 outbreaks because the virus knows no bounds. So as soon as you let the pressure off the virus by not social distancing, not washing your hands, and especially not wearing your mask, it spreads like wildfire. And think about it. New York City, they tamped it down. Seattle, they tamped it down. You look at the South, they tamped it down. And for some reason, we in the Midwest thought, hey, the virus really doesn't affect us at all, and as a result we really let down our guard. And the good news is we can do something about it. If you wash your hands, if you socially distance, if you wear your mask, we really can tamp this down. Because the reality is the immunization is not coming tomorrow. It's not coming next month. We're talking about the immunization for most of us is not going to come for 6 months to a year. It's a long time down the line. It's not tomorrow.
Well, it took Wisconsin 7 months to reach 100,000 cases. And then just Monday, 5 weeks later, we're at 200,000 cases.
Right.
So why such a dramatic spike in such a short amount of time?
Well, because what's happening is people are not social distancing, and so it's spreading like wildfire. It's like one person infects 2 or 3 people, because most of the virus affects you, even if you have symptoms, for 2 to 3 or 4 days before those symptoms occur. Most people, of course, are asymptomatic, to begin with. But if you look, for instance, at the middle of the state, you look at it up north, you look at places that are outside Dane County, people are just not paying attention. And a lot of people, for instance, are going to Sauk County, Columbia County, and other areas to have parties and gatherings because they can't do it in Dane County. And when you talk about it, that is just plain silly. We could use other words to describe it, but it's really not the right thing to do. And until we actually do that, we're not going to get it out of control. And the 200,000 may eventually increase to 300 and 400,000. And it's a shame. And it's especially a shame for those people who have lost loved ones. We're doing a better job of taking care of them. But look, we now have a field hospital in Milwaukee, and we're afraid, many are afraid, that we're going to run out of ICU beds because this is booming.
We run down these numbers all the time, but we have to remember that there's families and faces and people involved behind those numbers.
Exactly. It's one person at a time. If you have somebody, a loved one, who's in the hospital, for you, that's 100%. It's not 1 out of 1,000 or 1 out of 10,000. And so these are personal lives that are taken because people are not social distancing. And believe me, it's not just young people. You just have to go into stores outside of Madison. You discover there are a lot of people who are older who are not wearing masks either. And I think to myself, really? You've been through a lot in your life and you're not paying attention? I mean, an 18-year-old should pay attention, but 60 and 70-year-olds? So it's beyond my comprehension that people are not following the science. They're following politics, and politics is not science.
Hospital capacity is a big concern right now. We're at 85% statewide.
Exactly. And when it gets to 95 or 100%, then you have to triage. And that means you have to look and say, hey, I've got a 55-year-old who's sick and I've got an 85-year-old who's sick. Who's going to be the one who gets the ICU bed? Who's going to make that decision? Who's going to be the one to have the conversation with the family? And how are we all going to feel about it, let alone that family, their friends, and their neighbors? And we have a chance to still get this under control with simple public health measures that really count.
It is a frightening thought. All right, 270-9933, the number to call to talk to Zorba Pastor. All 4 lines are already full, so we'll get to your questions right after this.
Stand by, Zorba. We'll be right back.